Countless pressures at home, in school, on social media.
And today is World Teen Mental Wellness Day. So joining us this morning to talk about how teens can take care of their mental health is Dr. Schlechter. He's a child and adolescent psychiatrist at NYU Langone's Child Study Center.
Doctor, good morning to you. Thanks for being here to talk about this important topic.
Oh, thank you so much for having me.
So, Doctor, let's get into it. How would you characterize the mental health of America's teens in today's society?
Well, even before COVID, we had a mental health crisis, particularly for kids, because the most underserved area in all of medicine is child mental health, behavioral health. Both child psychiatrists and child psychologists do not meet the need in any state in the entire union. So then COVID happens, and we have kids highly isolated, and kids have come out the other end of COVID looking different. Kids who were anxious became beyond anxious, and a lot of kids didn't develop the skills to socialize. Right? We're talking about mental wellness today.
Yeah.
The number one predictor of our well-being is the quality of our relationships. And so when kids didn't know how to have relationships, we know it's going to have a huge impact on their well-being.
Yeah, and all that isolation, you heard about a lot of kids suffering from depression. So how bad is that problem right now, the problem of teen depression? And you already talked about how much the isolation contributed to it.
Right. So rates of suicidality have risen. The concern for mental health has surpassed almost any other medical disease that we have right now, the fear of it. And you brought up social media at the beginning. Social media can do wonderful things. I am speaking to you now through Zoom. The internet has done some good things, but you cannot find a study that says that any social media elevates well-being. In fact, the opposite. Mostly they lower well-being. They encourage comparison, and they can lead to some profoundly negative behaviors. So we have these things, we have this new technology that none of us are prepared for. All of these kids are walking around essentially with a casino in their pockets.
Yeah.
Right? This thing that every time it buzzes, by the way, this is me too. This is you, I assume, right?
Yeah.
Anytime your phone buzzes, your attention goes elsewhere, and you're hoping for a little jolt of dopamine to tell you if you're liked or you're not liked.
Well, right, which is a huge problem, right? And for children and adults. So what can parents do, right? Because parents obviously want to look for the warning signs. They want to see what's going on and be active and important role models in their children's life. But how do you really see if your child's having mental health struggles if they don't talk about it?
So that's a wonderful question. So I would say the number one reason parents come to me is they want to know how to discipline their children. And in fact, they're coming to me and I'm going to tell them the opposite. And I think, again, in spirit of Mental Wellness Day, I'm often going to start with, what are you doing that you're having fun with your kids? There is no night that goes by that my kids aren't going to play a card game with me, aren't going to play backgammon. And my kids are 12 and 14. The idea that parents need to be engaged with their kids off of technology in a way that they're having fun. On the weekend, I have from Friday night to Saturday night, I'm taking advantage of the Jewish tradition. I just say no technology. That doesn't always work. I go for low technology, a period when we just say we're going to step away from our screens a bit more. And we're going to play Monopoly. We're going to do things with each other. But the nature of it is when you know you need to get help. How do you know when you need to get help?
Yeah.
It's when your kid isn't functioning in school. It's when they've withdrawn from their friends. Maybe they're avoiding school. Or, of course, there are all of those other things. Are they starting to use marijuana? Are they using substances that they shouldn't be using? The legalization of marijuana is enormously complex for parents. How do you say, this is not safe for you when we're legalizing something?
Yeah.
That conversation has become much more difficult.
Yeah, it's really scary how much social media has led to bullying, etc. And teens spend so much time on social media, like TikTok. They just announced everyone under 18 will have their access default to just a 1 hour time limit. they can change the setting, but at least it's a platform acknowledging how they are impacting teens. But do you think that's enough? Do you think that limiting social media is enough?
It won't. We know it won't work, right? On cigarettes, on cartons of cigarettes, it says smoking kills, and we still sell 500 billion cigarettes a year. Right? If my Tropicana orange juice said Tropicana orange juice will kill me, I'd think twice. But we have all of these things out there. So I can tell you that social media is going to lower your well-being. Yeah. That is what every study has shown. So parents have to do the really difficult thing. There's a whole wait until 8 movement, trying to keep kids off phones until 8th grade. And that was something my wife and I aspired to, but during COVID, that went out the window.
Yeah, really.
It's impossible.
And so how do you break that cycle too, right? Because you go to social media sometimes to feel better, and now there's all these things on social media too that are self-help, different things on Instagram that you can read and inspirational quotes. And so it's cyclical because you go there to feel better, and then you leave feeling worse. So how do you break that cycle?
That's right. So it's called junk flow. Right? When I go out and I do some fun activity, I play tennis with my kids, go to the park with my kids. Afterwards, I feel invigorated. Yeah. But when you get off of social media, you never get off of Instagram and go, wow, I really just did something. That was amazing. Yeah. I'm calling mom. And so the idea of if we're going to pull social media away from kids, you have to be able to offer something else. And you'd want to say, go out and play with your friends. But because of COVID, so many kids don't know how to instigate that. So it really does. I don't want parents to helicopter their children.
Of course
I don't want them to protect them from all bad things. But a lot of kids need support. They need help. And then parents need to figure out a way how to do that while also being told that they're being totally intrusive and horrible. Yeah. So being a parent is, as I like to say, a huge mistake. It's just a terrible idea. You're totally in love with these things, and you're raising them to fall out of love with you. And yet it is the most enlightening thing I've ever done.
You crack me up. It definitely is a tough job. I mean, I have 10 and an 8-year-old, but you have inspired me, though, to get them outside. Yeah. And get active.
That's it.
So thank you again. We appreciate your time. Dr. Alan Schlechter from NYU Langone's Child Study Center.
Thanks so much.
You've been a wealth of knowledge for us this morning. We appreciate it.